a job. So Mount Sinai Adolescent Health Centre is situated up in the Upper East Side, and it's affiliated with Mount Sinai Hospital, but it's run independently. And it's really unique in that it's run on grants, and the kids can come there, they don't have to have any insurance, and they don't have to pay, so it's all free, it's free healthcare, it's like the UK. It's largely used from the South Bronx and East Harlem, but also the reach is huge, so kids come from all over because they've heard that they don't have to pay. And they can come there because it's New York State law that anybody, and actually in our clinic it's from 10 years old, in some clinics it's a little bit older, can come without parental consent. So their parents don't have to know anything about their visit. And so they're aged between 10 and 24 years old. And we see approximately 10,000 patients per year. And we have scheduled patients, but we also have walk-ins, so they can literally walk in off the street, and we see up to 40 patients a day just by that method. So I found that I've become passionate about adolescent medicine, and it's something that I just want to do for the rest of my life now. And that's because they're not just big kids, they're not little adults, they're their own entity. And their brains are rewiring, constantly developing during the adolescent phase. And in fact, we break adolescence into 3 phases, early, middle, late. And the middle adolescence is the time, so that's 13 to 17 years old, and that's the time when they're engaging in risk-taking behaviour. And that's throughout all aspects of their life, so whether that's with regard to relationships, sex, drug taking, and that's where we come in as healthcare providers to educate and inform them about the risks and then deal with the consequences of that risk-taking behaviour. And so, this is where text messaging, I think, can really play a role in that educating aspect. So, I started working in the Adolescent Health Centre about 2 years ago, and I've been, actually, even at my interview when I was sat in the waiting area, it was very evident then that they were all texting. So thumbs were moving, eyes were down, every power outlet had charges in it. And so, it struck me as I was sat there, wow, this is what they do when they just hang out. And then a couple of weeks into working there, I remember distinctly one patient, a 15-year-old, who came in for an STD screen, and she sat down and she immediately started texting. So I actually had to ask her to put her phone to the side while I asked her questions and took history from her. And then I started doing a pelvic exam and she was back there texting. So I said, who are you texting and what are you saying? And she just said very nonchalantly, well, I'm just telling my friend what you're doing and what you're saying. And then the other thing about it is that, one of the ethos of Mount Sinai Adolescent Health Centre is that once we have a patient there, we want to do as much as we can with them. They don't access healthcare very often, so while we've got them, we'll do everything we possibly can. And so we're doing so much education. And I often find that I'm starting to tell somebody about how to start birth control pill, and you see this glazed expression come across their face, and you know that they're not really taking in that information. That was the other thing that I thought, if we can somehow get to these kids after they leave the centre and clarify some of the things that we've been saying, then that might make